Hi, my name is Annika Ludwig, and today I'm going to be going over smartphone use at work, and this is for the class Integration of Genetics and Genomics into Ethical Nursing Practice at Rasmussen College. So there are unethical uses of smartphones. So a few of these uses would be texting about patients with someone who is not on the care team. So this would be sending information about someone to someone who shouldn't be privy to that information. Also taking pictures with patient identifiers in the background. So this could be knowingly that they're in the background or unknowingly that they're in the background. So it is within best practice to not take pictures in the work setting. Also, taking pictures of patient wounds on personal cell phones. So you can take pictures of wounds on patients as long as you have their written consent and if it's going into their medical chart. You shouldn't be taking pictures of people's wounds, no matter how fascinating they may be, on your personal cell phone. So the next would be benefits of smartphone use. So this gives the ability to look at medications as well as medication interactions online. There are many different applications that you can use on your smartphone that'll give you the severity of meta interactions as well as different dosage calculating apps to help make sure that you are giving the correct dosage of a medication. It also allows for increased communication capabilities with those on the healthcare team. So that would be texting over secured application, as well as voice calling and video conferencing with other members of the healthcare team. So this doesn't include calling your mom while you're at work to say what's up. This includes only talking to those who are in the healthcare setting and those who you need to talk to in the healthcare setting. Another would be to look up diseases and procedures that a healthcare worker isn't that familiar with. So sometimes when you're working on a unit, you may not see a certain disease or a certain procedure that comes up very often, and you might want to know exactly what's going on, what to look for in that disease, as well as what other comorbidities could be. Um, and then you also want to know what kind of procedure this person is going down for. If they have any questions, you then have the ability to help and answer those questions. Appropriate social media use. So this is really great, and it's really great that we live in a time where people can be sharing information on social media about this. So one of the benefits would be allowing for different messages about diseases to be sent out. So there can be proper information sent out by a healthcare professional instead of someone who did their own online research and is just sharing an article or publishing something online. People can actually put links to scientific articles that can give out the correct information. It can also be used to give out public service announcements. So this could be to help to warn the public about what diseases they should be preventing and how they can prevent them. So one example of that would be the common cold and people saying how you should be washing your hands, using hand sanitizer, staying in if you're feeling ill, those kinds of things. It can also give out resources for those in need. So you could have a medical professional who is sharing links to different websites that can help people get help. Like if someone needs psychiatric help but doesn't want to go out and necessarily get it in person, people can be sending out links to go to an online psychiatrist, to go to therapy online. Um, and especially if you don't have access to be able to go out to those people, you can get more access online and you can get those resources from healthcare professionals. Also, it can help to aid in education and practice of those still in school. So personally, I really like the app TikTok. It's a short little video app. Videos can be 15, 30 seconds or a minute. And one of my favorite things is I follow a bunch of different nursing accounts, and there are nurses that are showing you how to properly put on sterile gloves, how to don PPE, how to prime IVs, and those are just to name a few things. So it can be used for educational purposes as well. Now, some unethical uses of social media would be telling stories with patient identifiers. So sometimes you come home from work and you just want to vent about your day and you may make a Facebook post, but you may unintentionally put somebody's name in it. Now, that is not right. Or maybe you want to share a story of something great that happened at work and you accidentally put somebody's name in it. So best bet is to not make that post. You don't want to be giving away patient information. And you also want to set most of your accounts to private. If you can look someone up online, they can look you up online. So you may have a patient who gets a hold of your first and last name and they might want to look you up on social media. If your accounts aren't private, they then have information that you necessarily wouldn't want your patient to be having. And the best case scenario in that is that nothing comes out of it, but then they could figure out certain things that you just don't want patients to be knowing about you. So it is best practice to make all of your accounts private. So there are certain laws that as healthcare workers we have to abide by. One of them is the Health Insurance Portability and Accountability Act, which is HIPAA of 1996. So HIPAA is one of those laws that makes it so that patient information cannot be shared with anyone who is not appointed by the patient to know that information, and there can be legal consequences for sharing information. And that also ties into then the Health Information Technology for Economic and Clinical Health Act, which is HITECH of 2009. And when this was passed in 2009, it made HIPAA a little bit stronger and it kind of tied up some of those um, strings for the electronic side of healthcare because it helped with making electronic records a little bit tighter and more sealed. And then it also stated that if there is a health information leak, that those who may be affected need to be notified of this. So with those two acts, there are different consequences for breaking it. So there's a tier system. So if you are unaware of giving out information and it does not appear that you did it thoughtfully, there is a $100 to $50,000 fine per violation. If the second tier would be if they knew that the information got out and how like that they should have been doing something else, it is a $1,000 to $50,000 fine per violation. If they willfully neglected rules, but it was corrected within 30 days, there's a $10,000 to $50,000 fine per violation. And if it was willful but did not get corrected, it is a $50,000 fine per violation, and all of them have a cap of $1.5 million per year. And these are for the overall companies of the healthcare workers, but if you are caught in violation of HIPAA, you can be fired for that. And also, we have the Nursing Code of Ethics that we must stand by. And the Nursing Code of Ethics just kind of outlines that you shouldn't be sharing information about patients and that you should be doing your best to make sure that patients are taken care of the way that they should be taken care of. There aren't necessarily any consequences to breaking the Nursing Code of Ethics, but the Nursing Code of Ethics is backed up by different laws, and there are consequences for breaking different laws. And here are my references. Thank you.